Welcome, everyone. I want to welcome you and say hello from the four of us to Have an Empowered Pregnancy and Birth. I am Shonda Holt, your MC, and it's an incredible honor to spend the evening with each of you, along with these three incredible ladies that you're going to hear from: Judith Cobb, Dr. Rebecca-Jane McCallister, and Cora Tomowich. Thank you for coming this evening and spending time with us today. Just to cover some housekeeping things, we do have the chat enabled, and as they're going through their presentations, please feel free to drop in questions, because at the end, we're going to have a live Q&A, so if you have any questions, we'll get them answered for you. So right now, I'm going to introduce Judith Cobb. Judith Cobb has specialized in supporting women in their fertility and pregnancy journey for over 40 years. She's a master herbalist, a natural nutrition clinical practitioner, and a certified comprehensive iridologist, level 3, which, by the way, there are only 8 in the world, and Judith is our only one in Canada. Judith's passion is helping women achieve optimal health so they can enhance their fertility and enjoy the most vibrant pregnancy possible using herbs, supplements, and lifestyle. And she speaks from personal experience. She has birthed 7 children herself and has supported hundreds of women during pregnancy and before, during, and after pregnancy. Take it away, Judith.
Thanks so much, Shonda. Let's have our slides up, if you would, please, Shonda. There we go. And the next one, please, Shonda. Thank you so much. The time to plan for a healthy pregnancy optimally starts at least 6 months before you conceive. Ideally, it's best for us to work with both partners in that preconception phase. Even if you are ovulating, it's not necessarily a good indication of your fertility, hormone balance, or ability to have a healthy pregnancy. If you're already pregnant and we've missed that 6-month window to prepare, we'll simply start where you are. It's not like we can wind back the clock. It's also important to only minimally consider your mother's or sister's or aunt's pregnancy experience. It seems like women who've had a difficult time conceiving or being pregnant love to share their horror stories, if you know what I mean. I know my mom certainly did. Your relative's history does not need to be your story too. My goal is to empower you with knowledge and support to have the best pregnancy possible. So where do we start? Next slide, please, Shonda. If you're not pregnant yet, then we need to start with assessing your cycles. The easiest way to do that is using your daily body temperature and symptoms. Whoops. There we go. And symptoms that you have throughout your cycle. It's easy to do, and it takes just a couple of minutes each day, but must be done properly if it is to give us the most useful information to guide the rest of our work together. Variations in your temperature show us whether you are ovulating or not. If you're not ovulating, as could be the case if you have PCOS, your chart gives us clues about what we can do to help you ovulate. If you are ovulating, keeping a chart like this can alert us to hormone imbalances that need to be addressed to enhance fertility and support pregnancy. Next slide, please. While we're gathering information on your temperature chart, or if you're already pregnant, the next step is to assess your food and physical activity. We all know we are what we eat. So many women are so much more nutrition conscious now, and that's a very good thing to see. Sometimes, though, there are common things in the diet that are not health promoting. We do want to weed those things out and replace them with better choices. However, optimal food choices vary from woman to woman, and that's where I put on my natural nutrition clinical practitioner hat. Next slide, please. So that begs the question, what about morning sickness? Some women really suffer with this. There are natural remedies we can use to help with this. Many years ago, I worked with a mom who was pregnant for the first time. A few weeks into her pregnancy, she called me and said she was throwing up about 40, that's 40 times per day. At that rate, it was likely her doctor would hospitalize her and put her on intravenous fluids. Since she had an appointment with her doctor coming up soon, we had to try something fast. I gave her a specific combination of herbs in a liquid format and had her put a few drops under her tongue every few minutes. The nausea subsided quickly, and we were able to have her use the liquid herbs on a schedule that stopped the vomiting and kept her stomach settled. There used to be a doctor here in Calgary until he moved to BC. Not quite on that slide yet, please, Shonda, if you can roll it back. If not, we can leave it where it is. That's okay. There used to be a doctor here in Calgary until he moved to BC who would refer his patients to me if his prescription of diclectin didn't work to stop the vomiting or of morning sickness. He had seen how well the herbs worked on his patients that I shared with him, and he was happy to send them my way for relief. So back to diet. If you experience pregnancy nausea with vomiting, there is a selection of herbs and supplements we can choose from to help settle your stomach. Take heart, nausea usually subsides by the end of the first trimester, but sometimes it doesn't, and we have to keep addressing it until mama's stomach is settled. Next slide, please. There are certainly many discomforts that can arise in pregnancy, and our goal is to avoid all of them. Next slide, please. In the second trimester, it's not uncommon for moms to experience anemia. This is when your blood volume increases the most, and sometimes it's hard to keep the red blood cell formation up as high as it needs to be to fill the increased blood volume. What would you notice if you were anemic? You could be persistently, exceptionally fatigued. This is the kind of fatigue that is not relieved by a good sleep. You might feel short of breath, or have a rapid heartbeat, or have trouble concentrating. With any of these symptoms, it's a good idea to have your doctor order some simple blood tests. If they come back showing you are anemic, your doctor might recommend an iron supplement. I'm certainly not going to say you should not follow your doctor's advice. I am going to say that most prescription iron is constipating, and I don't know any pregnant woman who wants to be constipated. One of the first pregnant clients I worked with was a woman who was in her 30s, and she was considered to be a very high-risk pregnancy. She had a history of several abdominal surgeries for Crohn's disease and had lost a part of her small intestine that absorbs B12 to the Crohn's surgeries. As a result, her doctor gave her monthly B12 injections, and in her second trimester, she became severely anemic in spite of the B12 injections, and in spite of her really healthy diet as well. I added a herbal supplement and a digestive aid, and within less than 4 weeks, we had her blood counts back up in the healthy range. Her doctor, who was a very holistic MD, really appreciated the work we did to get her back on track. There are some simple dietary additions we can talk about, and there are many herbs that have been used safely for centuries to help pregnant women have more energy and feel more radiant. Now, I can't legally say that herbs can cure anemia. We're not allowed to make health claims for most herbs, in spite of centuries of use proving their safety, and in spite of modern research that explains why they work. Next slide, please. Thank you. The last trimester is the third trimester, of course, and it's weeks 28 to 40. And this is usually where we see the most discomforts. Some of the more common ones we see are things like constipation, heartburn, problems sleeping. Let's take a look at each of those discomforts. Next slide, please. Thank you. Constipation. In the third trimester, everything in mom's abdomen gets a little or a lot squished, including the stomach, the intestines, and the colon. At this stage of the game, the most practical anti-constipation measures include foods that have good but not gas-forming fiber content, stay well hydrated with water, and try to get a 30-minute walk every day. If your bowel is still reluctant, there are herbs we can use and other supplements that are safe to use in pregnancy that can get things moving gently. Next slide. And then we have heartburn. Some of the recommendations for heartburn and reflux are simple adjustments to lifestyle. So things like eat smaller meals, do not lay down for at least 2 hours after eating, drink fluids between meals, not with your meals, and drink mostly water, sleep with your head and torso elevated. If these don't work, there are very gentle and effective herbs that have been used successfully with pregnant women. It's always best to work with a qualified herbalist and nutrition coach who will follow your progress and modify recommendations as needed. All that midsection squishing pushes the stomach up, putting pressure on the lower esophageal sphincter. That's the sphincter at the very base of the esophagus that connects to the top of the stomach. And so when we've got pressure on there, and knowing that that sphincter relaxes in the last trimester, so it doesn't close very well, the result is heartburn and reflux. Next slide, please. So another common problem that we see is insomnia and sleep issues. I think it's just nature's way of getting you ready for disrupted nights that come with having a new baby. And those getting a good night's sleep in that last trimester is still important for your health. So waking up a few times each night is not a big deal if you get back to sleep fairly easily. If the back pain, or if you've got back pain or a full bladder or leg cramps or fetal activity or weird dreams, we're going to talk about each one of these just briefly. If back pain wakes you up, the solution could be as simple as sleeping with a body pillow to help you align your spine and hips while supporting your tummy. Maybe chiropractic with Rebecca or physiology therapy with Cora could be helpful here too. The solution for a full bladder is pretty obvious. Drink less in the evenings, but stay hydrated. Also note that as you get closer to delivery, your baby will sink down into your pelvis and will put more pressure on your bladder. That pressure will end after the baby's born. If you have leg cramps, then be careful to not point your toes when you stretch in the morning or during the night, because pointed toes are pretty much a guarantee that you're going to cramp up. Leg cramps can be an indication of a slight mineral or vitamin imbalance, and it's usually pretty easy to find the right solution to end the cramps. Fetal activity. An active baby is a healthy baby. Unfortunately, babies like movement, and they usually prefer to be active when their moms are being still. What if you have weird dreams that are interrupting your sleep? Well, you're probably just going to have to put up with them, but if they're upsetting or disturbing, be sure to talk with someone about them. Your doctor, your midwife, or your herbalist can be reassuring and give you the support you need. Next slide, please. Thank you. Last but not least, what about labor, delivery, and postpartum? Now, I'm not going to lie. Labor is hard work. It is intense, but it's intense with a reward. It's not like a headache that's just intense and miserable. So giving your body extra nutritional support with the right kinds of herbs, vitamins, and minerals in the last 6 weeks of pregnancy can actually make labor and delivery easier and, dare I say, more enjoyable. The postpartum phase, that first 3 months after you've had your baby, is a learning phase. And it's a time for you to reach out to people you trust, your healthcare providers of any description, and close friends who are experienced as well, to help you navigate these new experiences. There are herbs and dietary tips that can help you with breastfeeding, calming a fussy baby, and settling a colicky baby tummy. Nature often has answers to help us with conception, pregnancy, wellness, and labor and delivery, and postpartum. So I invite you to reach out to me, and if you've got questions or concerns and would like to work with a herbalist and nutritionist, I'm here, so just give me a call. Thanks so much for your attention.
Awesome. Thank you so much, Judith. There's so many things to consider that can happen in a pregnancy, and you are such an expert in your field, and we are so honored that you shared what you did with us. So next I'm going to introduce you Dr. Rebecca. I met Dr. Rebecca this year, and she truly is a very, very special lady. She graduated with her Bachelor of Human Kinetics in honors with a major in movement science, co-op, and a minor in psychology from the University of Windsor, her Doctor of Chiropractic degree from the Canadian Memorial Chiropractic College, as well as her contemporary medical acupuncture certification through McMaster University. Throughout her education, training, and clinical practices in, I lost my spot, in Prince Edward Island, Ontario, Alberta, and the Northwest Territories, Dr. Rebecca has always had a practice focus in treating low back pain, including pregnancy-related low back pain. And Dr. Rebecca works closely with every patient to create an individualized treatment plan that incorporates patient preferences, clinical experience, and high-quality research, recommendations to help you achieve your health and wellness goals. And we're really excited to hear what you have to say, teach all of us about having a great pregnancy. Rebecca, let's hear what you have to say.
Thank you so much, Shonda. So to start off the conversation, I guess what's maybe on everyone's mind is pregnancy-related low back pain actually that big of a problem? And what we know based on the research is that pregnancy-related back pain is experienced by up to 90% of pregnant women, with up to 35% of them classifying their pain as moderate, severe, or disabling, and negatively affecting their activities of daily living. We know that approximately 30% of women report their first bout of back pain during pregnancy. And although the pain often resolves spontaneously after birth, up to 75% of women may continue to experience pain up to 3 years postpartum. Now, women who experience postpartum related back pain at 3 months were at a higher risk for chronic low back pain throughout their lives. And now, why is that an important stat to know? Well, globally, in the general population, low back pain causes more disability, activity limitation, and missed work days than any other condition. Because pregnancy-related back pain often resolves after delivery and does not pose known serious risks to the mother or fetus, many healthcare providers dismiss these complaints as a temporary and self-limiting condition, meaning they just chalk it up to being a part of the pregnancy journey. Women with postpartum related back pain rarely seek healthcare services, and those who do often have their pain minimized by their healthcare provider, who unfortunately is usually unable to provide them with treatment or even information on their condition. Next slide, please. So it's important to understand that there's actually 3 types of pregnancy-related low back pain conditions. The first is pregnancy-related low back pain, and that's defined as pain between the lower ribs and the inferior gluteal or buttock fold. We also have pelvic girdle pain, which is defined as pain in the symphysis pubis, which is the bony part at the bottom of your pelvis, and or between the posterior iliac crest and gluteal folds, where the posterior iliac crest is the bony part of the hip you can feel when you're touching your back. And then when we have low back pain and pelvic girdle pain that occurs simultaneously, this is referred to as either combination or combined pain. Next slide, please. So how might you know if you would benefit from a chiropractic assessment during pregnancy? So if you find that you're having pain that is aggravated or provoked by prolonged standing, walking, or sitting, or you have pain when you're rolling over in bed, bending over to put on footwear, or even getting into or out of the car, it may be wise to reach out to a chiropractor who is well-versed in pregnancy-related low back pain. Additionally, if you're having pain that's limiting your ability to do your day-to-day activities, so again, things like bending over to tie your shoes, climbing stairs, standing on one leg when you're getting dressed in the morning, caring for another child in your home, or if you're experiencing pain in the low back, buttock, or leg regions, again, it may be beneficial to reach out to a chiropractor who is well-versed in pregnancy-related low back pain. Next slide, please. So after a thorough history and physical examination, a chiropractor will put together an individualized plan of management for your individual case. And quite often, that plan of management will include things such as patient education and advice. We really want to empower our patients to be self-advocates for their pain and to know what to expect and to be able to help themselves achieve their ultimate health and wellness goals. Supervised and home exercises. Again, when we're looking at muscle, nerve, and joint pain, the research is very clear that exercise rehab is one of the first line recommended interventions. Manual therapy, including spinal manipulation therapy, mobilizations, and soft tissue therapy. Spinal manipulation therapy is the classic adjustment that chiropractors are known to do. Mobilizations are also designed to help increase joint movement and range of motion, and soft tissue therapy to address some of those tight and tender muscles. They might also recommend kinesiotaping, which is what you see in the bottom photo there in the slide. Sometimes individuals who are pregnant are recommended to wear an SI joint belt to help with their low back pain. But often what I hear from individuals who are pregnant is that the SI joint belt is very cumbersome and very difficult to kind of put on and take off. And as you may or may not know, when you're pregnant, you tend to have to go to the bathroom more frequently, and people just tend to be non-compliant with the SI joint belt because it's not convenient for their day-to-day life. And that's where kinesiotaping may be really beneficial, because once the tape is on, it stays on until it falls off, and it also mimics the objective that the SI joint belt addresses. Next slide, please. So I'm also currently in the process of becoming certified as a GrowCo ambassador. And GrowCo believes that moms deserve more than just a 6-week checkup when it comes to recovery after childbirth. GrowCo experts fill this gap by providing a comprehensive postpartum checkup and progressive healing through exercise targeting the core, pelvic floor, and total body. The methodology is aimed at preventing, reducing, and/or resolving symptoms women may have been made to think are an inevitable consequence of childbirth. So if any of this intrigues you, or if you are curious about learning more, I encourage you to drop some questions in the chat for the end of the presentation, and to reach out via phone or email with any case-specific questions that you may have. Thank you.
All right. Thank you, Rebecca. That's awesome. So many things a chiropractor can do to help. I know one of the best things I ever did in my life was reach out and visit a chiropractor, which has now become part of my care routine. And it's so encouraging to know that they can also help when there's someone's pregnant. So that's awesome. Now we're going to move on to Cora Tomowich. Cora received her master's in 2013 in physiotherapy from McMaster University in Hamilton, Ontario. And throughout her career, Cora has maintained a special focus in pelvic health, prenatal and postpartum care, orthopedic and manual therapy, acupuncture, and sports-related injuries. Aren't these women amazing? They all have so much incredible training and skills. She works with each client to customize a treatment plan that uses only the best methods, supported by high-quality research, and she is absolutely honored to be part of your birthing journey. Welcome, Cora.
Thank you, Shonda. That's so nice of you. What a warm welcome. All right. So, hello, everyone. I'm Cora. We're going to be talking about pelvic floor and pelvic floor physiotherapy today. what I always tell my clients who are pregnant, who come to see me, the first thing I'll say to them is pregnancy is like running a marathon, and pelvic floor physiotherapy is how we can help to train for that marathon. So first and foremost, let's talk about the pelvic floor. The pelvic floor is a group of muscles. There's a whole bunch of little muscles that line the base of the abdomen and pelvis. These muscles span from the pubic joint in the front of the pelvis all the way to the back where the tailbone lives, and the very low back region known as the SI or sacroiliac joint region exists. And then these muscles span side to side between the hips, kind of like a big hammock lining the bottom of you. These muscles come in 3 layers. So there's lots of little muscles that, while each of them have their own individual function, they also contribute to one larger whole that we collectively call the pelvic floor. The pelvic floor has 5 main functions. The first one is a supportive function. So these muscles help to support the organs that live in the pelvis, namely the bladder, the uterus, and the rectum. If any of these organs kind of create a pressure in the pelvis, or they fall down into spaces where they do not belong, this is a sign of something called prolapse. And it just means that the pelvic floor is not really upholding its function in the supportive role. The second function that the pelvic floor has is sphincteric. So there are special sphincter muscles around the urethra and the rectum. If we are leaking, or on the flip side, if we are too retentive and not able to empty properly, the pelvic floor muscles are the culprit. The third role is sexual. So these muscles help to stimulate the glands that would naturally lubricate sexual openings or vaginal openings. Also, these pelvic floor muscles help to keep blood in the shaft of the penis during an erection. These muscles help to accommodate penetrative intercourse. So if we're having a lot of pain during intercourse, sometimes the pelvic floor can be a culprit. There is a stability function that the pelvic floor has. It helps to support the joints that it crosses, namely the pubic joint, the tailbone and the SI joints, the hips as well. And indirectly, the pelvic floor muscles really impact low back. Basically, one thing that's very important to note is that the pelvic floor does not operate by itself. Once upon a time, we all thought, oh, all we have to do is 3,000 Kegels a day and we are set for life. This is wrong. The pelvic floor has a synergistic function, which means it is not supposed to be isolated and functioning by itself. It likes to work with a team of muscles in the body, collectively known as the deep core. If you've ever been to an exercise class and they tell you, engage your core, they're trying to get you to activate your deep core. And I'm sorry to tell you, 99% of the time, they are telling you incorrect methods for activating the deep core. The pelvic floor is just one of 4 deep core muscles. The first and most important deep core muscle is your diaphragm. This is your breathing muscle. It lines the base of the ribs, just like the pelvic floor lines the base of the abdomen and pelvis. Diaphragm and pelvic floor are 2 deep core muscles that like to work together in a very synergistic pattern. They like to move almost like a bit of a sump pump. So when diaphragm lowers, pelvic floor lowers. When diaphragm raises, pelvic floor raises. This little sump pump action naturally activates the other 2 deep core muscles, such as the one that wraps around the body like a big belt, known as transversus abdominis, in case you want to practice your Latin. And then the 4th deep core muscle, which anchors each spinal vertebra to the one above and below it, known as multifidus. We want all 4 of these working in a very highly coordinated fashion. We do not want one superstar overshadowing the other 3. They need to work together. Next slide, please. All right, so what is pelvic floor physiotherapy? Well, as I sort of alluded to already, pelvic floor physiotherapy is so much more than just Kegels, okay? 99% of us are not doing our Kegels properly anyways. 100% of us should not be doing the traditional Kegel, hold your pelvic floor muscles and wait. No, it needs to be functioning. The pelvic floor needs to be functioning as part of the deep core. So pelvic floor physiotherapy, where I come in, is a collection of special skills that are used to treat these pelvic floor muscles. It often involves internal and external hands-on techniques. So with patient consent, we will actually go into the vaginal canal and or the rectal canal to feel what these muscles are doing. You cannot tell what they are doing from the outside. You can guess, but I like to be absolutely certain. And the gold standard of best practices state that internal techniques are the best. Pelvic floor physiotherapy is absolutely safe during pregnancy. We can do internal vaginal and rectal techniques during pregnancy, unless your healthcare provider, such as your doctor or your midwife, has suggested that you avoid all internal palpation. If you are told by your doctor or your midwife that you are not allowed to have intercourse, or that you have an incompetent cervix, or if you have placenta previa, we will avoid internal hands-on techniques for the time being until you are cleared. Next slide, please. All right, so when I see clients during pregnancy, I really just I structure the treatment plan, pelvic floor physio during pregnancy, labor prep, and postpartum. So what do we do during pregnancy? Well, there's actually quite a lot. We do a lot of education. We discuss the importance of the pelvic floor and the deep core, which, hey, we just did. We begin a lot of postural work as well. During pregnancy, center of gravity will shift. We will change the way we use our muscles and bones, and posture suffers. So we begin some posture work right away. I will also discuss with each of my moms the basic do's and don'ts during pregnancy. Do move around to your comfort level. Don't sit in terrible postures for extended periods of time. There is an app that I often recommend to my new moms. It is called Rost Moves Mamas. I believe it is a free app. It was the last time I checked. It is an excellent do and don't app. I believe it is for Android and Apple phones, and it can be a wonderful quick reference for what to do and what not to do, such as what position should I hold while I'm vacuuming? What position should I avoid when sitting? What position should I sleep in? These sorts of things. And it's a very helpful tool to use, very easy to go through. Other things we do during pregnancy are exercises. Lots and lots and lots of body balancing. Your baby is going to sit in your belly the exact way that your body lets your baby do so. If you are tight on one side, baby is going to favor the other side. If you are imbalanced, baby is going to end up in an awkward position. So we want to make sure that we really optimize baby's position so that they are head down, facing your back, which is known as occiput anterior, towards the end of pregnancy, getting ready for delivery. We'll discuss prenatal yoga. I also do a lot of yoga with my clients. I do have my training in that area, and to wonderful results. So many moms really like to stay active, and it's safe to do so as long as you're listening to your body. We'll do a lot of core and modified core breathing. This is the superior version of Kegels. Kegels are just about isolating the pelvic floor, squeezing and holding. Core breathing is about learning to build your pelvic floor with the other muscles of the deep core. Modified core breathing is actually the breathing we recommend you use during labor and delivery. It is a wonderful way to teach your pelvic floor to relax and open so that baby may move through. Other things that we'll do during pregnancy, manual therapy. So we'll treat the pelvic, I'll treat the pelvic floor using massage techniques and any surrounding muscles that are experiencing tightness, weakness, or pain. We will address any sacroiliac joint or pubic symphysis dysfunction as well. Very similar to what Dr. Rebecca-Jane McCallister was saying in terms of we can do some taping, we can do some belts, we can talk about different products that might be helpful in supporting that area. Next slide, please. Oh, shoot. No worries. Okay, so to prepare for labor, I do a lot of labor prep with my clients. Typically when I'm seeing a mom during pregnancy, I will see if she has no issues, I will see her once every 4 to 6 weeks just to make sure everything is up to snuff. If she's having more issues such as pain or incontinence, I might see her more frequently. As we get closer to her expected due date, we do lots of labor prep. So we'll talk about, we'll do education in the form of supplementary products. So we'll talk about the ab tank. This is something that can be worn immediately postpartum to help the abdomen come back to its original size. We'll talk about the sacroiliac or the SI belt, as we mentioned in earlier slides. We'll also talk about something called the Epino. The Epino I don't think is available in Canada anymore, but some women do still have them. What this is, it's a sort of a catheter device that's inserted into the vagina, and it's designed to help stretch the vagina in preparation for baby. We'll do lots of exercises in labor preparation as well. So we'll review any of our breathing and body balancing exercises. And believe me, there are plenty to work with. We will also encourage baby into a good birth position. So while I don't move baby through belly, I will teach you exercises so that you can encourage baby to be in the best position. We'll talk about some self-care techniques. A lot of moms are very interested in learning about perineal massage. There's a modified version of perineal massage, and one of my favorite techniques to help prepare the perineum is something called the peace sign stretch. These are techniques that can be done at home. Either mom can do them for herself or her partner can do them for her. And they're wonderful ways to help just stretch out the opening of the vaginal canal so that tearing becomes less of a main concern. One thing that I do that is unique, I've taken many midwifery and doula courses, and I've put together a program that I call Mock Labor Day. So this happens about 4 weeks before the expected due date. Mom and her partner, or whoever she plans to have with her in the delivery room, come into my clinic, and we practice everything from labor positions. We practice hands-on techniques that partner can do to help mom. We'll practice how to push, because they're not necessarily teaching you how to push properly in the hospitals, unfortunately. We'll also talk about troubleshooting techniques, what to do when baby is not engaging, when labor is stalled. What do we do about it? Instead of just defaulting to a C-section, we can try some things in the interim. We'll also talk about how to prepare the birth team, how you can talk to your doctors, how you can make sure that you are always getting informed consent when you are going forward with these, with labor and delivery. Next slide, please. All right, so we've had the baby and we are now in postpartum care. So pelvic floor physiotherapy can begin at any time in the postpartum phase. However, internal techniques or internal work does not begin until 6 weeks postpartum. We like to give the area some time to rest. But postpartum care in the form of pelvic floor physiotherapy is vital after any birth, vaginal or cesarean. A lot of moms will say, oh, I had a C-section, my pelvic floor is fine. Unfortunately, that is incorrect. There is a lot of connective tissue and fascia and muscles that exist between the ribs and the knees that significantly impact the pelvic floor. If they are not happy campers, the pelvic floor will not be a happy camper either. So we want to make sure that we are addressing all of those areas to ensure you have the most smooth recovery of all time. During the postpartum phase, we review the birth story. I ask a lot of questions. How long did you push for? Was there any physical or emotional or even mental trauma that occurred during the birth? Any complications? Were there any tools used to help with the delivery, such as a vacuum or a forceps assist? During the postpartum phase, we will also do a lot of manual therapy. So we will treat any sore muscles. We will start to strengthen any weak muscles. We'll address any scar tissue, either from an episiotomy, a natural tear, or a C-section. We can also, as pelvic floor physiotherapists, discuss breast health. So if a mom is experiencing some mastitis, we can talk about little things that you can do at home that would be very helpful in treating that either yourself, or we can also address it in clinic. We'll do lots of education around exercises as well. So a lot of times moms will experience a wonderful high after having a baby and feel like they want to hit the gym the next day. Thank you, oxytocin. However, you do not want to get back to the gym too quickly. So we'll talk about activity modifications, things to do, things not to do. You do not want to rush back into physical activity. You can make things much, much worse if you do. So in the first 2 weeks postpartum, you're doing minimal activity, lifting baby, hanging around at home, just getting used to being a new mom. Around 3 to 6 weeks postpartum, that's when we can start walking up to 30 minutes a day. We can do some breathing and pelvic floor exercises as well. Around 6 to 12 weeks postpartum, this is when we start to build more of a home exercise program. So doing things that mom wants to do at home and getting her ready to do her specific activities, such as whatever she wants to do. And around 12 weeks, we do goal specific activities. So this, say, for example, mom wants to do yoga. We will start building yoga into her home exercise program while also maintaining the integrity of the pelvic floor. If mom wants to become a runner, this is around the time that we'll start building a very, very gentle running program to get her used to the impact. You have a new body after you have a baby, so you want to make sure that it knows how to adapt to the activities that you want to participate in. Next slide, please. And that's it for me. Thank you. If you ever have any questions, please feel free to call my clinic. You'll have that information come out shortly, and Shonda will wrap things up for us here. But I'm happy to answer any questions over a 15-minute phone call if you have any specific questions about your health needs.
Awesome. Thank you so much, Judith, Cora, and Rebecca. I know that we've got some questions. So since you're on, Cora, and you're not muted, I'll start with you. So what is your opinion about Bang Kung belly binding postpartum? Is it safe for the pelvic floor?
Yes. Okay. So there's lots of different kinds of belly binding options out there, and I'm absolutely fine with them. However, please do not use these techniques in lieu of doing your pelvic floor exercises. All too often, moms will go into these belly binds and then they will just not do their pelvic floor exercises. And by that, I mean the breathing exercises that have been prescribed by your pelvic floor physio. I'd be happy to give them to you now, but I'm not able to because I haven't assessed anyone here. So what I would say absolutely is see a pelvic physio, get those exercises, and use the belly bind as you like. Make sure you use them together, because when you take the belly bind off and you haven't done your exercises, you will feel like a limp noodle, and it will be that much harder to overcome that sensation and that weakness.
Awesome. Thank you, Cora. Rebecca, now I'm going to do a little preamble here, because I remember my very first chiropractic visit, and we may have people that are watching this that have never been to a chiropractor. And the chiropractor happened to be a friend of the person who referred me. And I remember going back to work going, oh my gosh, the man practically laid on me. I was horrified because he didn't actually explain what I was going to do, because he thought I'd been to a chiropractor before. So the question is, when someone's pregnant, what can they expect on their first visit and after when they come to see you?
Yeah, very good question. So on the first visit, when someone comes in, we do a very detailed history. So, where is your pain located? How long has it been going on for? What makes it feel better? What makes it feel worse? Coupled with assessing for conditions that may fall outside of my scope and warrant a referral to midwife, OBGYN, etc., as well as a personal health history, family health history, talking about any concerns or expectations or ideas you might have regarding care, whether or not it is your first chiropractic visit or you've received chiropractic before. And then we move into the physical exam. The purpose of the physical exam is to try to recreate the pain complaint that you've come in with. And the reason why that's so important is because if I'm able to recreate it in my physical exam, I usually have a pretty good understanding of what's contributing to your pain and what we can do to help. After the physical exam, we'll talk about the findings and go through how I think it all ties together and what I think the diagnosis is. We'll talk about recommended plan of management, so what types of treatment options I think would be beneficial, your thoughts and feelings towards those. I think it's really important, again, to create a treatment plan that not only considers my experience treating individuals who have been pregnant and the research recommendations, but also patient preferences and what the individual is comfortable with. And it's ever evolving. So, you might decide initially that you're not comfortable with an adjustment, and that's okay. And you can always revisit that idea down the road if things change. And then we'll move into treatment and home care recommendations, and discussing how often I think it would be expected for you to come back in. Typically, I see people more frequently as they come closer to labor and delivery, just because baby's growing, you tend to be a bit more uncomfortable, and that sort of thing. And then after delivery, People often will say, well, when can I come back in for chiropractic care? And it's really whenever you're comfortable, you feel comfortable and ready to come back in for an appointment.
Awesome. That gives people a good picture of what to expect. So I love that. So Judith, you're up next. We'll ask. I got a few questions here for you. So we're getting some questions very specifically about what herbs are recommended for morning sickness, for anemia. And so I'm going to add to that I'm going to combine a few questions as well. So we've got some specific questions for herbs, and then are they safe? But because, we always hear from our doctor and in the media not to take anything when we're pregnant. So I'm just going to have you address kind of those combined questions.
Fantastic. Thank you so much, Shonda. Are herbs safe to use in pregnancy? It's kind of a loaded question. And I say that because in general, herbs are safe. Not all herbs are safe, and not all herbs are safe for every person. So this is where the woman, any client, whether they're pregnant or not, any person should be working with a trained herbalist, so that herbalist can help assess whether the particular herbs that would meet the need are actually not just appropriate, but are safe for that individual. So, when we're looking at specific things like what herbs are recommended for morning sickness, there are several. And again, that's going to depend very much on the individual, on allergies, on sensitivities, on their perception of taste. Especially in pregnancy, the sense of taste and smell can really shift. And a herb that I might recommend for one woman who's pregnant might be a total no-fly zone for another woman. So it's pretty hard to give a specific list. I mean, I could just give a list, but that would be a little bit reckless. And for anemia as well, it's pretty much the same thing. With anemia, we need to be aware that there are herbs that are iron rich, but it's not always iron supply that is the problem. Sometimes it's digestion that's the problem. And so this is where the person should be working with a trained herbalist who can help assess whether there are some digestive questions that need to be addressed, and maybe fixing the digestion solves the anemia, helps the person to get more iron out of their food. Maybe they really do need more iron in their foods, and would they be better with a solid herb, like a herbal powder that's in a capsule, or would they be better off with a herbal tea? Which one will work best for their body? So again, there are many herbs that can be useful for building iron, but we need to know the client to give the best information for that individual.
Awesome. Really important, really important. So I'm going to move on to Cora. So Cora, I'm going to say, talk about the elephant in the room because I'm pretty transparent. So I've actually been to a pelvic floor specialist when I lived on Vancouver Island. And you obviously get people that come to you that might be a little shy about internal exams. You talked a lot about some body parts that I'm sure people are sitting in a little discomfort talking about out loud, and then having somebody touch them. So give us an idea of two things, and I'm combining some questions here so we can cover things. Obviously, internal exams are part of the therapy that you do. And so give us a picture of that person that might be really terrified to go and have this done. And how safe is it during pregnancy?
Yeah. So first of all, we don't do anything until a client or a patient is fully on board, full consent. Internal work, while it is the gold standard in what the research has shown in really identifying the issues of the pelvic floor and being able to treat those issues, it's not mandatory. I won't ever say to anyone, you have to do this, otherwise you're not going to get benefit. There's ways that we can work around it if someone is very, very nervous. I have had a lot of people come in who start off very, very nervous, but my initial assessment always begins with at least 30 minutes of conversation, finding out what the issue is, what their goals are, discussing pelvic floor history, what menstrual cycle is like, what sexual health is like, bladder, bowel function, pregnancy history. And for males, we'll discuss, similar things, sexual history as well. It's that half an hour, I find we build a lot of rapport. And in that half an hour, the clients are thinking, oh, well, this is fantastic. I feel safe with this person. Absolutely. Let's go forth. And if that's the case, great. I would say 99% of the time that is the case. The odd time, some clients are like, you know what, I'm still not ready for internal work. Can we try external stuff? And in which case, yeah, absolutely. We can do all kinds of things externally that will help, just as long as clients know that we're working on best estimations rather than tried and true, we know what your muscles are doing. Now, during pregnancy, it's absolutely safe, as I was saying, unless there is the presence of placenta previa, an incompetent cervix, or any reason that the doctor or midwife has suggested to the mom no penetrative intercourse. Intercourse is so much more aggressive than anything that I would do. It's 1, maybe 2 fingers into the area that that patient has had or is looking to have treated. I don't use any tools. The speculum, not even in my clinic. I'm just focusing on the pelvic floor, not going too deep. I go in as far as my fingers will take me and as far as mom is comfortable. The other thing that I think is important to note is that a lot of times when we go to a urologist or a gynecologist, it's very, white coat, impersonal, you just feel this person in that area down there. You can't see their head or face. I'm sitting next to you. I'm sitting next to my client. We're actually having a conversation during the treatment. And it's very, like, at any point in time, we can stop the assessment or treatment. They can ask questions. There's laughing, there's jokes. It's a relaxing environment. I have made sure that my clinic really promotes that relaxation, that comfort. So there's nothing that anyone will ever be forced to do. And it's actually a lot more pleasant than any trip to a gynecologist.
And people don't know me, but I was a nurse for 30 years and I'm a huge teacher of being a patient advocate and teaching people how to advocate for themselves. You, as the patient, are always in control, and you
All the time.
always have the option to say no to anybody touching you in any way at any appointment by any provider.
Even in labor, by the way.
I think that's really important. I had to school a nurse practitioner that I wasn't changing into a paper gown without meeting her, because I wasn't going to allow her to touch me, or she wasn't going to touch me until I gave her permission, and I wasn't going to give permission until I met her and felt comfortable and safe. And I think safety is a really important part of all of this, whether you're talking about herbs and having somebody do nutrition and counseling, whether you're having a chiropractor or a pelvic floor specialist. I think safety is just so important, and you are always in control. So
Absolutely. In fact, quick little fun fact, if you want to call it a fun fact, something like 33% of births are traumatic, not because of the physical, not because of the actual delivery, but because moms didn't feel in control of the experience. They felt like a specimen on the table and doctors doing their thing without getting informed consent. So that's something that I do a lot in my labor preparation, how to prepare the birth team. Okay. Tell your doctors, back off if they're getting up in your face. Telling partners how to advocate for mom. That's the nice thing about having either a family member or partner there, as opposed to being by yourself, because then they can advocate for you. So I'm right on board with you, Shonda.
I just think it's a good thing to teach people. And even as a nurse, when I'm a patient, I'm not comfortable with doing that. But I think it's really important, and you get more comfortable.
Yeah.
The more times you take that view of yourself as a patient. So just my little tip. Okay. Who's next? Let's see. Rebecca. Let's we have a question for you, and then we're going to go to Judith. So so give us a picture of what post-care delivery that you do, Rebecca.
Yes, that's a good question. So during pregnancy, I would say, again, a lot of the pain complaints are related to the low back and pelvic area. But after labor and delivery, like I had mentioned, 75% of women may continue to experience low back or pelvic girdle pain up to 3 years postpartum. So some women may continue to see me for low back pain. And other women, the low back pain spontaneously resolves post-delivery. But then you transition roles. You become mom, you may start to breastfeed or bottle feed, which tends to lead to a lot of like upper back neck type pain because you're leaning over or you're picking up baby in awkward positions. Carriers, car seats, not the most ergonomically friendly devices out there. And so I tend to see a lot of moms to be during their pregnancy for low back pain. Some continue to seek low back pain care after labor and delivery, but sometimes we end up switching gears and we actually end up looking at different parts of the spine and ergonomics and ways to just help mom stay comfortable with all of the physical demands that are put on her during those newborn months.
Yeah, and isn't it nice after you've had a baby and you get a little bit of time to take care of yourself, and that's important. When baby is priority, but mom is too. If the foundational support isn't there from the mom, it affects baby too. Okay, let's move on to Judith. Thank you, Rebecca. So Judith, come on. Do I really need to come and see you? I mean, I can just Google. Can I just Google everything? Google knows everything.
You know what? You absolutely can Google, and you can get a lot of really great, very generic advice. That advice is not going to be specific to you. It's not going to take into account your health history, your current symptoms, allergies and sensitivities. It's not going to take into account whether you're even capable of following whatever the program is, whether it's nutritional recommendations or a herbal recommendation, or it's not going to give you specific information on how much of something to take for you. You know, you're going to see the generic recommendations that are based on government guidelines, which may not be optimal for most people. Or you're going to see people that are way out there recommending amounts that are really, really high that may not be appropriate for you. So yeah, you know, if you really want to lock it down and have a program that is specifically for you, that is balanced for you, with a practitioner who's going to tweak that and morph that program depending on where you're at, because what you want for pregnancy prep is going to be a little different for once you've conceived. And depending on how strong that pregnancy is, there might be some specific tweaks we need to do to get you through that first trimester. And then as we are addressing different concerns in the pregnancy, different discomforts, different little things that pop up, we want to be able to modify the program and keep it very fluid. It's one of the reasons that I offer what I call my concierge care program, which is just a monthly subscription program that gives my clients a lot of access to me, not just for an appointment, but also for in-between care, just to make sure they're getting their questions answered in a timely fashion and that things that come up are being addressed as they come up, not 3 weeks later when they've got an appointment scheduled, right? So you need to come see me. I think if you want to have really excellent support, if you want to feel supported, if you want to have the opportunity to learn about your body and your health and to learn how to avert or prevent problems, then yeah, you probably need to come see me.
Yeah, okay, I'm going to sum that up in just a few words. If you want to get like the best results, right? We can all Google and we can all try different things and do all this stuff and be all over the place. But if you want the best results, go to the expert. Judith, another quick question for you. Is the level of alcohol in herbal tinctures safe during pregnancy and breastfeeding? That's a really good question.
That is a great question. So depending on the specific herb you're talking about, the alcohol concentration could be anywhere from 25 to 50%. You're not drinking 2 ounces of this stuff at a time. You're usually taking it, 20 drops at a time. So 10 drops or less of alcohol per time you take it. It is likely safe. And I'm going to say that because, again, I don't know the background of the person, right? If I'm working with someone who is a recovering alcoholic, then no, that amount of alcohol is never safe, right? If I'm working with someone who is not an alcoholic or a recovering alcoholic, but has either religious or societal beliefs that alcohol is not good, then I'm not going to recommend that. What I would do is I would have them take that alcohol tincture and heat a little bit of water and put that serving of alcohol, of extract in there, let it sit for 5 to 10 minutes so that the heat will dissipate the alcohol. And then you're getting an alcohol-free tincture.
Ooh, such a cool tip. Thank you.
Yeah. It's a nice way to get around it for people who are sensitive for whatever reason. I'm not sensitive, so I don't worry about it for myself. But again, for my clients, I tend to be very aware of that. I want them to not only feel safe and comfortable, but to be confident that what they're doing is a good thing.
Awesome. So I've got 2 more questions. And the first one is going to be to Cora and the last one to Rebecca. Cora, does insurance cover your services?
Yes, that's a very good question. So I am a licensed physiotherapist in the province of Alberta. As long as somebody has physiotherapy insurance, because I am working within my scope of practice, you are absolutely covered. I don't specify what kind of physio you're coming in for either. I also see people for shoulder injuries and back pain. I don't say shoulder assessment. I just say physiotherapy initial assessment. And it could be pelvic floor. It could be orthopedic. It's not the insurance company's business.
Awesome. That's awesome for a lot of people.
Yeah.
Rebecca, do you feel like spinal manipulation can be effective and lasting without soft tissue work, or is soft tissue work kind of critical and goes hand in hand with adjustments?
Yes, that's a really good question. When you look at the research of the mechanism of a spinal adjustment, there's a few different theories out there. Not to get too detailed or scientific in it, I would say the patients who come to see me enjoy how thorough and all-encompassing my treatments are. I'm not the type of chiropractor who is just going to give you an adjustment and send you on your way. I would say the vast majority, if not all, of my treatment plans include some component of soft tissue therapy, mobilization, manipulation, exercise rehab, home care advice, ergonomic advice, sleep posture advice, whatever I think is going to benefit you in the long run at home. We have that discussion in clinic. So, you could talk to the academics and they could argue back and forth about what it is spinal manipulation does and whether or not the soft tissue component with it is beneficial, whether you should do soft tissue before an adjustment or after an adjustment. There's lots of debate out there about it. I would say bottom line is my patients enjoy it. They see benefit from it. I would argue there's benefit to it from my clinical experience. And so as long as the patient is game to have soft tissue work done, they get it. If they're game to have an adjustment, they get it, as long as it's appropriate and indicated and the patient consents.
Awesome. It's always good to know your perspective when you're thinking about coming to visit someone. So thank you, Rebecca. All right. Once again, I want to thank you so much for joining us tonight to learn more about how to have an empowered pregnancy and birth. So watch your emails for more information on how to connect with each of these amazing ladies, Judith, Cora, and Rebecca. And from myself, we all want to wish you a lovely evening. You'll get the recording as well as all their contact information. So reach out if you have questions or you need more support with your pregnancy. Thank you, everybody.
And Shonda, thank you so much for being a brilliant MC. We appreciate you.
Yes.
Yay!
Thank you. Yeah, thank you so much.